Capital Women's Care started 20 years ago. It was formed by several physicians who saw a need based on the cost of healthcare at the time and thought that there should be some way they could get together and share the administrative burden.
So in 1998, there were about 6 of us small practices that got together and started a regular meeting to discuss how we adapt to the changes that were occurring in healthcare and how we could make a better group practice so that the physician could actually spend more time with the patient.
And as they looked at what was happening around the country, they saw that people were forming larger groups in order to get better technology and be able to afford the technology and thereby giving the patient a better experience.
And we started December 1998, and that's why we look at January 19th as our 20-year anniversary.
We were able to then go out and be the first ones to adopt the electronic health record. We were the first ones to be able to let patients travel between sites and not have to ask for their medical record. So we saved money and gave the patient a better experience.
It helps the patient in 2 ways. One is access. As I said, we provide access multiple ways of making appointments, reaching the doctor. When they come in, they can go to the kiosk. But if you prefer the traditional way of talking to somebody, we still provide receptionists that will greet you and get the information from you directly.
Then the second piece of it was coming into the office, and instead of being paper, a doctor can sit down with a tablet, can dictate right into the medical record, and then everything is right there. Patient can leave the office with their visit in hand and what happened at that visit.
The other benefit to patients is that the physician is more focused on patient care. Their job is to take good care of patients and let other people worry about the rest. And that has been a huge difference to the doctors who want to practice good medicine, provide the up-to-date care in patients, and let the professionals handle all the business side of providing care to women that are non-medicine related.
So Capital Women's Care, when they started, was primarily in Montgomery and PG County. We started with 27 doctors. We now have 270 providers, 78 locations, and we're in Maryland, Virginia, and the District of Columbia.
After finding Debbie Red, and when we went to the newer IT solutions of billing and electronic medical record, is when we really started growing.
Because as the technology moved, we had to move with it. And the thing about medicine that I like the best is that it changes all the time. So if you don't change with it, you get left behind. We currently are adopting a mobile application of technology because people now want to go on to their phones and make appointments. We also have a patient portal where patients can go in and make appointments and register and pay bills. And in the next 3 months, we'll have telemedicine, so we can actually do Skyping with patients for visits. Patients don't want to travel, they work. There are more women working in the workforce today than ever in the history of this country. And so they want, visit when they want it, how they want it, and quick.
That's the best thing about Capital Women's Care. We recognize there's many generations of patients and there's many generations of physicians. And we need to have the ability for all of them to practice efficiently with the up-to-date technology, but with also the up-to-date medicine and providing the best care for women today.
We now do urogynecology for women, pelvic floor therapy for women. We have some people do robotic surgery, some do cosmetic surgery for women. So we have the full gamut of services.
We've been out here the longest, and we're a proven success story. Our patient population grows every year. We've proven over time that our model works best and has improved patient care. Every decision we make is always about the patient, and we never forget that goal.
We have patients who have been here for 3 generations. We have the lowest employee turnover rate of any healthcare company in the state of Maryland. And I think this attests to we're a good place to work. Our doctors are happy, our employees are happy, and guess what? Our patients are happier.
What we've created with Capital Women's Care, the future is us in the field of obstetrics, gynecology, and healthcare for women.
I would like to say to patients who have been with us for years and continue to be with us, thank you. I think I speak not only on behalf of myself, but also our doctors, our nurses, our administrative staff. We wouldn't be here without you. Thank you so much for continuing to come to see Capital Women's Care.